The mission of the cancer support community is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. And our vision is that no one should have to face cancer alone. And I think a key idea behind our work is that it takes a community to really support a person who is living with cancer, to really to improve their quality of life and their health care. We do this in a number of different ways. We do it through research, we do it through program and education, and we also do it through policy. And when we think about research, we think about really elevating the patient voice. We have a wonderful program called the Cancer Experience Registry, which is for all people impacted by cancer. They can join the registry, and we really learn from them about what are the pressing needs, what are the pressing social and emotional needs of cancer patients and their caregivers and their family members and their loved ones. And that is used to help inform where are their gaps in care. From that we can develop innovative programs to reach these needs, but not just us, the advocacy community at large, and not just advocacy, but also healthcare as well. And this information is also designed to help inform policy. What is it that we're learning from patients and their families that can help inform how we can do a better job as a society in providing meaningful, comprehensive cancer care that's going to make a difference in people's lives.
And I think there's a real focus now on listening to the voices of the patients and their family members, the people who are actually impacted by a diagnosis of cancer, and not just assuming that as advocates we know best what people want. And then we take that information that comes through our research to develop innovative programs that are directly impacting the lives of people living with cancer, both people with the diagnosis, family and friends. And we do that in a couple of different ways. We provide direct face-to-face services at our 50 centers across the country, and also we have a new model of embedding cancer support communities in hospital settings and in federally qualified healthcare centers as well. We also provide services online through our living room, where we do online support groups, real-time online support groups, discussion boards, provide lots of information and education to people. It ties back to our mission, really, that it's support, education, and empowerment of people. And then finally, through our helpline, where we directly help people impacted by cancer and their families with concrete needs, with emotional support, across the whole spectrum of the cancer experience, from even the pre-vivors, people concerned about their genetic risk of cancer, through the newly diagnosed, the post-treatment folks, the long-term survivors, and even through bereavement, through all of those three, the online, the face-to-face, and the helpline.
Another point to mention is that there are a number of sort of key components to our model of programming. First and foremost, that patients and families are the experts in their own experience and that they can learn from each other. The other aspect of our program is also that all of our programs are professionally led. So whether you go to a program in Grand Rapids or a program in Los Angeles or Chicago or Philadelphia.
Or online.
Or online, that's right. You'll be greeted by both other patients like you and other family members, and also a professional who's really trained to facilitate some of those sort of difficult discussions and also help empower patients to really take control of their lives and to improve their communications with their healthcare team, with their doctors and their nurses, so that they can get the most out of the healthcare that they can.